हेलो व्यूअर्स, वेलकम टू दी लर्नर्स नर्सिंग क्लासेस। आज हम मल्टीपल चॉइस क्वेश्चंस करेंगे बेस्ड ऑन दी नर्सिंग फाउंडेशन। बिफोर दैट लेट्स हैव अ थॉट ऑफ द डे। डोंट बी लिमिटेड बाय योर लिमिटेशंस। इनएबिलिटी टू कंट्रोल यूरिनेशन इज यूरिनरी इनकॉन्टिनेंस। इनकॉन्टिनेंस का मतलब होता है लैक ऑफ वॉलेंट्री कंट्रोल। रिफ्लेक्स का मतलब होता है बैकवर्ड फ्लो। रिटेंशन मतलब नॉट एबल टू वॉइड कंप्लीटली खाली नहीं कर पाना। डाइवर्जन मतलब यू टर्न, लाइक टेकिंग अनदर टर्न, सम गोइंग समवेयर एल्स। एबनॉर्मल बैकवर्ड फ्लो, आई जस्ट नाउ टोल्ड यू द आंसर इज रिफ्लक्स. Sensation of dizziness or spinning is vertigo. Now whirling sensation मतलब गोल गोल घूमना, चक्कर आना, and loss of balance, that is vertigo. Syncope is the loss of consciousness, बेहोश हो जाना एकदम से, that is syncope. Synapse, it is the point of contact between the neurons where the exchange of information is happening, and synergy means combination of two groups. Presence of pus in the urine is pyuria. What is anuria? Lack of urine. What is dysuria? Pain while urination. And what is oliguria? Low urine output. Crepitus is seen in fracture. We should know what is crepitus. Crackling, grating sound caused by bones rubbing against each other. So here the answer is fracture. Insomnia means absence of sleep. Source of primary data is patient, because patient हमें सबसे पहले अपनी information देता है. The safest position for an unconscious patient is lateral, because lateral position में tongue falling back नहीं होता है, पेशेंट की गैस्ट्रिक एस्पिरेशन नहीं होती है, ओरल कैविटी की सिक्रीशंस लंग्स में नहीं जाती हैं, तो दिस इज द सेफेस्ट पोजीशन. The surgical procedure in which an opening is made is called as ostomy. Like stoma formation. What is otomy? To cut. For example, durotomy. The cutting of dura is called as durotomy. Now what is Rrhaphy? Rrhaphy means to suture or to repair, like corporrhaphy, the repair of the perineum. And what is autopsy? Post-mortem examination to know the cause of the death is called as autopsy. The temporary paralysis of intestinal wall is paralytic ileus, when there is paralysis of the intestinal wall. Now this happens after the abdominal surgeries or some infection. We should know what is peristalsis. The series of wave-like muscle contraction is called peristalsis. And what is tympanitic? It is the distension of the abdomen due to accumulation of gas in the intestinal cavity or the peritoneal cavity. And what is flatulence? Flatulence means passing of the flatus. Now, what is the tiny purple or the red spots appear on the skin is called petechiae. These happens, for example, after dengue or when the platelet goes down, that time it happens. We should also know what is erythema. It is the redness of the skin. What is eczema? It is the inflammation and itching of the skin, and dermatitis is the inflammation of the dermis. Now, presence of protein in the urine. Word itself is explanatory. Proteinuria. The symptoms of itching is pruritus. Condition in which the radial pulse is less than the ventricular rate is here the answer is pulse deficit. Now what is pulse deficit? We should know difference between the apical pulse and the peripheral pulse rate. What is apical pulse? I will tell you. Then comes, but we should know the pulse pressure. What is pulse pressure? The systolic minus the diastolic. For example, if the patient's blood pressure is 120 by 80 millimeters of mercury, then we will minus 120 minus 80, that is equal to 40, which is an averagely normal pulse pressure. Now what is apical pulse? The apex of the heart is located where on the chest? That pulse point is called as apical pulse. And radial pulse is the radial artery on the wrist, that is the pulsation of the radial artery. Device to aid in the immobilization of the patient is restraints. These are used in OT or while shifting the patient. This is just to restrict the patient's movement to aid in the treatment. Bath in which only the hips or the buttocks are immersed in the fluid, it is called sitz bath. They are done in perineal surgeries. The secretions of the sweat, when the patient is profusely sweating, that process, what is that called? It is called as diaphoresis. Now it is the secondary condition due to some illness it is happening, like hypothyroidism or postmenopausal. What is perspiration? It is excess of sweating. What is diffusion? The high concentration molecules are going into the lower concentration molecule to create an equilibrium through the semi-permeable membrane. And what is dehydration? It is a significant loss of the body fluid caused by some illness, या फिर profuse sweating हुई है, या पानी कम पिया है, hydration कम है, then it happens. Increase in the number of stools and the passage of liquid unformed feces is diarrhea. Now I will tell you what is constipation. Less than 3 bowel movements in a week is constipation. And what is fecal impaction? Hardened stool stuck in the rectum or the lower colon due to constipation. And obstipation, it is a severe or the complete complication. Constipation. Painful menstruation is dysmenorrhea. Absence of lens is aphakia. Abnormal accumulation of fluid in the intestinal space of the tissue is called edema. The normal respiration is eupnea. What is dyspnea? The shortness of breath. What is apnea? No respiration. What is orthopnea? Patient is uncomfortable while lying down and comfortable while sitting and breathing. Accumulation of hardened fecal matter in the rectum or the sigmoid colon is called as fecal impaction. Vomiting of blood is called as hematemesis. And when the blood is mixed with the sputum, it is called as hemoptysis. When there is a bleeding from the nose, it is called as epistaxis. And when it is a dark terry red color stool, it is called as melena. Inability to control passage of feces or gas from the anus is incontinence, fecal incontinence. When there is no control, voluntary control is not there. Pneumonia that results from the fluid accumulation as a result of inactivity. Here the answer is hypostatic pneumonia. Now, long-term bedridden patients slowly develop chronic pulmonary disorders. These are hypostatic pneumonias. Now, what is orthostatic pneumonia? When the collection of fluid is in the dorsal region of the lung due to bedridden, confined, supine position. That is orthostatic. What is aspiration pneumonia? When the gastric content or patient what swallowing, eating something goes into the respiratory tract, that is called as aspiration pneumonia. And pneumonia of the bacterial infection or bacterial origin is called as bacterial pneumonia. Sound heard during the blood pressure using a sphygmomanometer is Korotkov sound, which was given by the Russian physician. So the name Korotkov is based on the Russian physician. What is the Brute sound? It is an audible vascular sound associated with the turbulent blood flow. This is palpated also and can be heard with the help of stethoscope. Drug that acts to promote the bowel movement or bowel evacuation is laxative. So laxative are a treatment for constipation because these are the chemicals that help to increase the stool motility. Now, what is purgative? Loosen the stool and promote the bowel movement. Emollients are softeners, and antihelminthics are the drugs to treat the parasitic infections. Now, infection caused by a treatment or a diagnostic procedure is iatrogenic infection. Bleeding per rectum is melena. I told you, when there is a bleeding from the rectum or there is a dark terry red color stool, that is called as melena. Hematuria is the blood in urine. Hematoma is the collection of blood, and hemorrhage is bleeding. I have covered 30 questions. That was all for today. This is the picture I took in the evening for all of you. This is Himachal. Thank you so much. Like, subscribe, and share.